Hi, I'm Dave Miersch. I am Revelwood's Workday Adaptive Planning practice leader, and today I'm going to be going through a very quick demo of our multi-site healthcare organization process within adaptive planning, and hope you like what you see, and there'll be more to come with this. This is just a very quick high-level view, but there's much more to come. Okay, and going from the staff assumptions, another big driver in this space as far as expense and staffing is going to be something related to capacity, and capacity is going to be driven by patient volume. Now, this sheet here is volume and production, so this does include some areas for revenue and expense planning above the staff level. That'll be something we will show in more detail in a different demo. For this case, I want to focus solely on the patient volume and growth. So in this case, we're looking at trending actuals from history, in this case, for this situation, going back to the 12 months prior and applying a 2.5% growth rate on this metric. Again, that is coming from some just general assumptions from history. And then we have that active office flag you can see here. That drives some additional calculations. Again, that flag is coming from that original clinic database assumptions sheet. Now, the important piece is that this volume then flows into our support staffing model. Now, I had this focused solely on the nurse type role. What you see here for actuals is going to be trending history for how many staff in this location do we have for this role, as well as their metrics for hours per day, patient capacity per day, and similar things like that. Now, the important thing you're going to see here is that we're looking at the previous month's trending FTE, and then looking at, okay, how many patients are we expecting to come from volume to this office for the given month? Convert that to a metric of hours, go back to our patient staff assumptions in the other assumption sheet, and that gives us basically what our capacity is versus what our target is. You can see here our staff capacity is 8 patients per day. However, this model for the month of May is projecting 10 patients per day. So that means we're actually over capacity. That's an important metric in this space to see on a monthly basis, are we actually going to have more or less staff than we really need at that given time? Based on that over/under capacity, Adaptive automatically calculates for me how many staff I need to add or subtract to meet that volume, right? And then that volume is going to be specific to that given month. We're assuming we're going to have movements across different locations, so we're always netting out to match our capacity. We then drive that number down to what does that mean in terms of total staff hours for the month? What is my average rate for my assumption sheet? And that gives you my expense along with my fringe to a total compensation expense for this location for this role. And again, this also flows into the other staff positions as well. Now, outside of volume and production and staff, a big piece of the conversation within multi-site healthcare is often revenue recognition. And there can be revenue recognition from a variety of areas. In this case, we have a lot of experience doing this with the ortho space in dentistry. Other areas, very similar process. But we'll show it within the ortho model. So I'm going to start at a high level and work my way backwards here. In this case, we're looking at the same location who's also serving orthodontia, and we have our payers as a dimension. Now, that payer dimension drives different revenue recognition policies across the company. These numbers you see here represent the total contract value from all patient visits within that given month. That's not the revenue rec, that is the net production, or excuse me, gross production. So if I do a row details on the Blue Cross dimension for this location, and I'm going to expand my revenue recognition waterfall, I'll go over to 2024 just to start, as well as scroll down to my waterfall. And you will see the waterfall filling in for all those patient visits for that given month. the revenue recognition where I have a large chunk being recognized the first month of this policy, and then much smaller pieces being recognized, in this case, February 2024. I have $81,000 being recognized in month 1, $23.92 throughout the remainder of the life until I get to month 24, which is outside of this time period, and that has a different recognition policy as well. Now, this data flows back into a total revenue summary sheet. Similar process here. How are we getting those total contract values? Well, we're looking at history. We're looking at growth rates. We're taking average contract value from the last 12 months, and we're applying our respective rate of growth as far as what is my average case rate going to be. I then also look at what is my last 12 months average volume per month. I'm doing simple math of A times B to give me my gross production. And then that feeds into this model, the total revenue recognition that I'm going to have to account for within that given period. The other big piece within this space, within multi-site healthcare, is going to be revenue recognition. Now, we do this across a variety of industries. However, for this example, we're going to be focusing on ortho revenue recognition. As you can imagine, braces are a long-term investment for patients, and also the requirement for the companies and the locations to recognize that revenue over the course of those braces being applied. Now, for here, we're going to start high level looking at total monthly gross production by the dimension of payer. And the reason we have that dimension there is the payer drives different types of revenue recognition policies. Some might be flatlined across 24 months. In this case, the Blue Cross payer, there actually is a much higher recognition up front and then a smaller amount across the remaining 24 months of that 24-month contract. And that could all be flexible based on your actual needs. It may be shorter, maybe longer. You may have a different actual recognition policy altogether. So I'm going to go to 2024 just to show as an example here. We can see that for 2024, we have a gross production of $9,400. I'm going to expand this view, this waterfall, and I'm going to go back to January real quick. And I'm also going to scroll down to where that revenue recognition starts. Now, if I look at the January 24 row, that is representing the actual total row of data for that recognition of January data. You'll see there is that big chunk of dollars being recognized the first period, and then much smaller recognition being applied across the remaining months until we get to our last month, which is month 24. The remaining amount gets recognized in a larger lump sum as well. Now, this waterfall aggregates all the history for the prior 24 months, the future 24 months, into a total monthly recognition. If I jump to this ortho revenue sheet, this sheet has the data by level, by payer, and we're actually pulling that total gross amount. Here's my $9,400 for January I just showed you, as well as what is the total recognition for all periods that feed into that given month. Now, how we're getting there from a high level is we're looking at prior 12-month average contract rates. We're applying a specific rate growth on top of that case rate. Same thing with monthly cases. We are looking at a trending history of what my last 12 months were. Now, for your situation, that may be the last 3 months. It might be a direct input. It could be a variety of options. We feel that the last 12-month look back is the most consistent with that growth rate applied. Those numbers become simple math. A times B gives us our total gross production for the month, and that number flows back into that gross production revenue waterfall that I just showed you, and that's how we get full circle. And I'll just show one last piece here. 71,473 is my total gross production for the month of May 2024. In my waterfall, you can see that number right there. That's pulling directly from that sheet and then applying the recognition from there. Well, thank you for following along, attending this quick demo with me. I hope you found this interesting and useful and enlightening. There's a lot to do with this industry and a lot we can do with you with an adaptive. We found a lot of success with people in this space. There's a lot more to this as well, as I mentioned previously, and we'd be more than happy to show you those details, whether it be the dashboards, the revenue forecasting process, and other components within multi-site healthcare planning. If there are any additional questions, feel free to reach out to us directly at info@revelwood.com.